I'm a certified registered nurse anesthetist, or CRNA. I basically put people to sleep for a procedure. I first learned about CRNA in high school. I went to a vocational magnet high school where I was able to rotate through the hospital. In the operating room, I saw a student CRNA who waved me over and told me everything about the profession and why I should pursue it.
What does your day to day look like?
I'm usually up by 5 o'clock in the morning. I get to the hospital between 6:30 and 6:45, make sure everything that I need in my room is set up. And then at 7 o'clock, I meet my first patient. I introduce myself, interview them, get their past medical, surgical history, talk to them about the anesthetic plan. And then around 7:30, we're rolling back into the operating room where we induce, manage, and emerge the patient safely before taking them to the recovery unit. And we repeat this process with every patient until the end of our shift.
What type of settings do CRNAs work in?
CRNAs can work in a hospital setting where they work in a care team model with anesthesiologists. There can also be anesthesiology assistants there. And then CRNAs can also work in an outpatient setting, like outpatient surgical centers, like same-day surgeries. They can work in fertility clinics, providing anesthesia with just them and the surgeon or the person providing the procedure.
What's the difference between a CRNA and an anesthesiologist assistant?
I would say the difference is the route that they get to become an anesthesia provider. So CRNAs have to get a bachelor's of science in nursing first. They need to work in a critical care setting, usually in ICU, for about 2 to 3 years before being able to apply to a graduate program, which is another 3-year doctoral program that specializes in anesthesia. And an anesthesiology assistant, they have to get a 4-year bachelor's, and they usually do like biochem or some pre-med route, and then once they have their bachelor's degree, they can apply to an AA program, which is anesthesiology assistant program, which I think is 2 years before they start working in the field as an anesthesia provider, which we all get along and we all do really well together.